I want to bring in now Connecticut Governor Ned Lamont, who today announced his state is coordinating coronavirus response efforts with New York and New Jersey. Governor, tell me how you and those other governors came to make the decision and issue the announcement today about gyms and bars and restaurants and the like.
Well, Chris, you summarized it very well in your introduction. You can't wait for the feds to take the lead. So I, as a small state of Connecticut, doesn't work for me just to do restaurants and bars alone. So do it in coordination with Andrew Cuomo in New York and Murphy down in New Jersey. It makes a lot of sense. I was on the phone with Rhode Island today. So we're taking the lead where the feds have fallen off. We've got a lead. But I got to tell you, what really brings it home was, last night, the bars were pretty crowded in this city, and people weren't taking this to heart. Now they're closed. People know this is real.
It's notable, I think. I've looked at some metrics today about traffic and things like that. Clearly, this is having an effect. What are you doing at the state level? What are your public health experts telling you about how to understand what's coming your way?
I was on the phone with all the hospital system today, and we've got to do a lot more now. We're going to have a hit on our ICUs, our intensive care units. We have no idea what's coming, and that's going to mean more people, more nurses, more beds, more equipment, more ventilators. We're not getting much help from the feds, and as the president said, go get your own ventilators, but you don't get that at Amazon.com. We're working this hard to do what we can to prepare, but that wave is just a week or two away.
Are there simple, clear things in terms of, say, Medicaid reimbursement that the federal government could be doing, could be stepping in to aid your efforts right now that you're not getting?
Well, you've described the testing in some detail right now. I've got to do a better job of convincing folks if they're ill, they're not feeling right, they may have some early case of the flu, stay home. We're going to take care of you in terms of getting paid, take care of you in terms of health care, but you got to have the get up and go to stay home. Stay home. Going to the office, going to work, going to school, that's a dangerous place to be these days if you're not feeling right.
I get that message. We've been communicating that to our viewers that basically at this point we need to keep ERs clear for the most at risk. But as you think about your ICUs reaching a capacity potentially as the pandemic grows, like, what do you need? What resources do you need, and where can you get them? And can you get them from the federal government? Are there easy things the federal government can do for you?
Well, I can tell you Danbury Hospital is already at capacity, and they have 200 nurses who are on furlough because they were in contact. If I could test those nurses, I could potentially get them back into the game a lot sooner.
You've got 200 nurses sitting on the sidelines right now who can't get back to work because they can't be tested to confirm whether or not they have the virus?
Exactly. I mean, we got a surge in use. Demand is going up, and I'm losing nurses by the day who have to furlough themselves for a period of time. That's a priority for testing for me. Our testing capacity is going up, but it's going up very incrementally, and that's dangerous.
On the economic front, you heard what Greg Gonzalez just said. Obviously, this is enormous social disruption, enormous economic disruption and hardship. What can the state do, and what are you planning?
We are working with our small businesses right now. We have a lot of folks in the service sector. You know, their store, their business, their restaurant, their bar, that's stopped. And what can we do to help them get through? How can we provide, unemployment compensation so their folks are covered for a period of time? I'm providing small business loans right now to help them cover this bridge. We have loan forgiveness, or at least making sure that they don't have to pay any interest and principal for the next 3 or 4 months, giving enough confidence they'll be able to power through this.
Final question for you. I know there's a teleconference with the president today, and obviously you're coordinating with regional governors here. You said you're talking to the governor of Rhode Island. Does there exist like a daily call for state staff of governors to be on and coordinating every day here?
Yeah, we're picking up the void. I got to tell you, what we did with New Jersey, New York, and Connecticut, I think, is the first real regional oomph. And we're going to do this on a regular basis. I've also got Charlie Baker and Gina Raimondo in Massachusetts and Rhode Island. We've got to work together closely. We got to figure out where are the hospital assets, how best to deploy them, where do we get the beds and the nurses.
So there are conversations about that kind of movement between regions as different places are going to have this at different times.
That exactly. I hope other regions are doing the same thing. Best done on a national basis. Best done with a national leadership. Short of that, we've got to go ahead as governors, and we are. I've been really impressed with the initiative the governors are showing.
All right, Governor Ned Lamont of Connecticut. Thank you, sir.